Good day, I'm Elakkana and today I'll walk you through the dried blood spot, also known as DBS collection process. This procedure is essential for healthcare professionals and patients alike for accurate diagnostics at QUA Nutrition. Why DBS? Dried blood spot collection is a crucial tool in diagnostics used to identify genes and biomarkers for various conditions including neurological disorders and for therapeutic drug monitoring. It's particularly advantageous due to its simplicity and non-invasiveness, facilitating early diagnosis and better health outcomes. Instructions for dried blood spot testing sample collection. Ensure you read these instructions carefully before beginning. Proper sample collection is crucial for accurate test results. This is the dried blood spot card. You have to give the blood sample on the barcode side. Here is the lancet needle for piercing the finger. Alcohol swab to clean your fingers. Let's look into the step-by-step instructions. Number 1. Preparation. Wash your hands thoroughly with warm water and soap. This helps increasing the blood circulation. Dry your hands completely with a clean towel. Number 2. Selecting a finger. Use the middle or ring finger of your non-dominant hand for best results. Avoid the pinky finger, thumb or index finger as they are more usable fingertips. Number 3. Preparing the finger. Clean the selected finger using the alcohol swab and let it dry completely. Rub and massage your hand and specific fingers to increase blood flow to the specific finger. This helps in good blood flow. Number 4. Collecting the sample. Twist and remove the sterile lancet cap. Place the lancet snugly and firmly against the side of the fingertip. Press the lancet as it punctures the skin. Number 5. Dropping blood onto the collection card. Drop each blood drop as it flows into the circle in the collection card. Let the drop fall naturally onto the designed circles. Gently massage your finger from the base to the tip to encourage blood flow. Repeat the above action. Each circle should have at least 3 to 4 drops of blood or no empty space left. Fill at least 4 to 5 circles with blood. Each spot should soak through completely without smearing. In case the blood flow stops before filling the complete card, you can use the lancet on another finger for more blood to fill the card until no empty space is left. Number 6. Stopping the bleeding. Use the gauze pad to gently press on your finger. Apply an adhesive bandage once bleeding stops. Number 7. Drying the sample. Let the card air dry flat. Do not blow on it or touch the spots or fold the card. Number 8. Packing the sample. Once dry, place the collection card into the sealable plastic bag with a desiccant pack. Seal the bag properly to prevent moisture exposure. Shipping the sample. Place the sealed bag into the return envelope provided. Ship the sample as soon as possible following the provided instructions for mailing. Number 10. Don'ts. Please make sure not to smear or touch the card. Please note that this test cannot be done by clients who suffer from severe blood disorder and people who are on anticoagulants. Make sure the circles are saturated with blood. Don't add blood on sheet once the existing sample has dried, as this could lead to sample failure. Sample sufficiency means all the circles are filled and the card is dry completely. Looking for a simple, hassle-free way to get the crucial insights about your health? Our dry blood spot test makes it easy and convenient right from the comfort of your home. Just a few drops of blood can reveal critical information about your nutrition, fitness, immunity, and much more. Ready to take control of your health? Reach out to QUA Nutrition today and get your dry blood spot test kit delivered to your doorstep. Your journey to better health starts with a single drop. Using the DBS collection method allows us to perform essential tests with ease and efficiency, crucial for the diagnostic services provided by QUA Nutrition. This method is a cornerstone of our commitment to proactive health management.